Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Diagnosis of polycystic kidney disease. Polycystic kidney disease is mainly diagnosed on ultrasonography. On ultrasonography, you will see that the kidney is enlarged and there is increased medullary echogenicity is increased in polycystic kidney disease mainly because of the presence of the cysts. Then, in polycystic kidney disease, if you do an intravenous pyelogram, okay, here one important thing is in the polycystic kidney disease, there is cysts are present all over the kidney. Now, if you do a intravenous pyelogram, this pyelogram will not reach this dye which is used in intravenous pyelogram. This is not reaches the cysts. Okay, so as a result it will go to all the areas around the cysts but does not reach the cysts. So because of these cysts are seen as holes in the cheese, and this gives the appearance of Swiss cheese appearance or presence of bubble like appearance. Because the calyces, and in the early cases the calyces, renal calyces which are seen, these are stretched. Because of this stretching of these renal calyces, these looks like a spider leg or bell like deformity. So in intravenous pyelography you will see two things. One, there is stretching of the calyces of the cysts causing spider leg or bell like deformity. Second, bubble appearance is seen mainly because of the calyceal distortion. At the same time, Swiss cheese appearance is also seen in intravenous pyelography. On CT scan is the investigation of choice for autosomal dominant polycystic kidney disease.
thank you and thank you for watching.